Of all the Black people diagnosed with HIV last year, half of them were diagnosed late. And late diagnosis has a really significant impact. It means that somebody hasn't been able to access treatment at an early stage. It means they're at greater risk of getting ill or even dying. And it means that they have an ongoing risk potentially of transmitting the virus to their partners because they don't benefit from treatment and U equals U. I mean, I think there are similar reasons why particularly Black and minority ethnic communities don't engage with testing as to why they sometimes struggle with engaging with care after that. A lot of it is about stigma. A lot of it is about fear. A lot of it is about, I think, perhaps people not feeling that they're potentially at risk from HIV. It's that sense of it's other people who get HIV. It's not me, or it's not people like me or people like my family. The fear of the diagnosis, perhaps not understanding that it's a completely treatable disease, that they can live long, healthy lives, have families, have babies, have new partners, sexual partners, don't transmit the virus. So I think there's still a lot of people who see it like the disease it was in the 80s and 90s and don't understand how different it is now. I think also sometimes the system doesn't help. A lot of HIV testing happens in sexual health services. For a lot of people, it's not acceptable to go to sexual health services. It's not a common thing. It's not a particularly nice thing. It's not a very convenient thing. You may not have one that lives nearby you. You might have to queue to get in. You might get turned away. They're very busy. So we in the NHS sometimes put too many barriers up against people testing. So I think that's why initiatives around testing, like self-testing for HIV, where you can now just go online, not everywhere in the country, but you can now just go online and just order a kit, do a finger prick, get the result yourself, like doing and reading a pregnancy test. So super simple, don't have to go to a clinic, super confidential, no shame, no embarrassment. And then obviously if it's a reactive result, we can wrap you up and take you into the services and give you all the support you need. And also self-sampling, similarly where you order a test online, do it yourself and post it off. So I think there's a lot that the system needs to do to make sure that those new testing initiatives are available to all communities.